Dr. Dalila Dodge and Lynn Phantom of the Penn State Cancer Institute are here ahead of the show and ahead of a web chat to discuss the topic. So it's going to be tonight on ABC27 at 7:30. There's going to be specialists from the Penn State Cancer Institute, also the Penn State Breast Center. They're going to be in our call center. They're going to be ready to take calls, take emails. What are we going to learn tonight?
We hope you're going to learn some about breast health, about our screening methods and treatment that we have for breast cancer. We're also going to have a couple inspirational stories from patients.
Yeah, and those stories always, like you said, inspirational. They always give us hope to know when you're faced with a diagnosis like that, there is hope, there is recovery that can happen for you. But it does seem like breast cancer, breast disease, we still hear a lot about it. Can you give us some of the latest statistics?
Well, 1 in 8 women are going to develop breast cancer. The American Cancer Society estimates in 2016, 240,000 women will be diagnosed with breast cancer, and 40,000 of those women are going to die. It's the second most common cause of death, cancer death, after lung cancer. But you also can look at the fact that 80% of those women are not going to be statistics in terms of death. So we've made great progress in the treatment of breast cancer.
Yes, I like that. Let's focus on that, the 80% number. So there are some risk factors. I know some we can't control, some maybe we can control. Can we go through some of those?
Well, family history is one that we all know about, and there's a gene associated, or several genes that are associated with breast cancer. So a family history of breast cancer, especially in first-degree relatives, or ovarian cancer are red flags for that. And we have a high-risk assessment clinic where patients can come and have models done and be advised as to their risk and potentially undergo genetic testing. Age is a risk factor. As we get older, can't control that, and breast density is a risk factor. So if on mammography your breasts are very dense, you have a higher risk of developing breast cancer, and you can't find that out until after you've actually had a mammogram.
Sure.
There's some controllable risk factors, what we call modifiable risk factors. So excess weight gain, lack of exercise, excess alcohol, using hormone replacement therapy for a long period of time. Those are all things that we can change and potentially modify and lower our risk of developing breast cancer.
Good. I'd like to have a little bit of power there to know that I can do something proactive.
Exactly.
Another thing we can do proactively, prevention, early detection. Let's talk about mammograms.
So screening is so important. It's really a key component to diagnosing breast cancer early and hopefully making the outcomes much better. So screening, we use mammography. We still at Penn State Breast Center recommend the age of 40. Now we do recommend you talk with your doctors again about family history, breast density, things like that, because some patients may need to be screened earlier. We also have the ability to use breast MRI. We use that for our breast cancer patients as well as our high-risk patients, and also automated whole breast ultrasound. So we have a whole slew of screening opportunities for patients. And I just want to throw in there, if you don't have insurance, you can get a free mammogram. So that's not a reason to not get a mammogram. So,
very well said.
So that's so important that you know that you can get a free mammogram and not have to skip your screenings.